President Trump announced his plan to combat nationwide opioid drug addiction today, among other things, calling for stronger punishment for drug dealers, including the death penalty for some. William Brangham reports.
The president flew to New Hampshire to make his announcement, a state he once called a drug-infested den. It has the nation's third highest death rate from opioid overdoses. But in Manchester today, Mr. Trump vowed more aggressive prosecution, including the death penalty for traffickers.
If we don't get tough on the drug dealers, we're wasting our time. Just remember that. We're wasting our time. And that toughness includes the death penalty.
Federal law already allows for executions in cases that involve murders committed during drug-related crimes. The human rights group Harm Reduction International, based in London, says the United States and 31 other countries have the death penalty for drug crimes, but only 7 routinely carry out executions. Earlier this month, Mr. Trump cited 2 of those, Singapore and China, as examples.
If you go to Singapore, I said, Mr. President, what happens with your drugs? No, we don't have a problem, President. I said, really, why? We have a zero tolerance. And he's not playing games. These guys don't play games.
Beyond the death penalty, the president also called for other initiatives to tackle the opioid crisis. They include new laws making it easier to impose mandatory minimum sentences on opioid drug dealers, increased education and awareness programs, broader access to medically assisted treatment options, and more aggressive prosecutions of doctors, pharmacies, and opioid manufacturers.
Our Department of Justice is looking very seriously into bringing major litigation against some of these drug companies.
The president is also setting a goal of cutting opioid prescriptions by 1/3 in 3 years and boosting research into non-addictive painkillers. Opioid prescriptions have declined somewhat in recent years, but an average of 115 Americans still die each day from opioid-related overdoses. The Centers for Disease Control and Prevention reports opioids killed more than 42,000 Americans in 2016, the most ever recorded. Many states, like New Hampshire, are overwhelmed. Last month, the Granite State's largest drug rehab provider announced its closing for want of funds. While Congress promised $6 billion over 2 years to help battle opioids, few specifics have been offered as to how and where the money will be spent.
So we take a closer look now at what the president's new proposals could mean for the opioid crisis. With Sam Quinones, he's a journalist and author of Dreamland, The True Tale of America's Opiate Epidemic, and Dr. Andrew Kolodny. He's co-director of opioid policy research at Brandeis University's Heller School, and he's also executive director of Physicians for Responsible Opioid Prescribing. Gentlemen, thank you both very much for being here. Andrew Kolodny, I'd like to start with you first. Could you just give me your reaction to the proposals that the president laid out today?
Well, what we heard from the president, I think, is a list of ideas, some of which sound good, others which sound like a step backward. What we still have not received from the Trump administration is a plan of action, and we've yet to hear President Trump request funding from Congress, a multi-year, multi-billion-dollar funding request to address the problem until we build out a treatment system that doesn't really exist yet so that people who are opioid addicted can more easily access treatment than they can access painkillers, heroin, or fentanyl. Until we get there, I think we're going to continue to experience record high levels of opioid overdose deaths.
Sam Quinones, the headline out of the president's announcement was death penalty for drug dealers, for drug traffickers. Right. What do you make of that?
Well, at first, kind of half facetiously, I was wondering, is he referring to doctors? Is he referring to drug company executives and drug salesmen? Because, of course, this epidemic is unlike any other that we've had, which it begins with those folks, not with drug traffickers, street gangs, and mafiosos. I welcome the idea that the president is getting behind this. I welcome, as Andrew said, there's some ideas that a lot of people have been calling for a long time. I find that the idea of a death penalty is kind of like it's like the silver bullet right? The idea like, well, this will solve our problems. This is how we got into this problem in the first place. Everybody wanted a silver bullet, an answer to all human pain, and the answer was narcotic painkillers, and supposedly they're non-addictive. I think as a country, we really are playing with fire when we begin to look to easy answers. It's a complicated problem. It needs a lot of complicated and small solutions all across the country. And what it also does is divert attention from the place where this work is really going on, which is in a lot of counties where folks have just banded together. It's beautiful to watch. It's exhilarating, very American thing to watch. I love it. You go to these counties and people are coming together, county task forces, working groups, learning to work together. So for so long we've been so isolated. These groups have not worked together very well. And now, I was hoping part of what he would say would be, I'm going to go to these areas, I'm going to tell them what a great job they're doing. Right. I'm going to put the focus on them, not on me.
Andrew Kolodny, let's talk about some of those specifics. One of the things that the president mentioned was he wants to cut opioid prescriptions by 1/3 in 3 years. Is that an important thing to do? How realistic is that? What did you make of that part of the president's proposal?
Yeah, I think it's a worthwhile goal, and it can be hard to understand why it's still important to focus on the overprescribing problem when deaths involving illicitly synthesized opioids like fentanyl are soaring. But it is very important. We're not going to be able to bring the opioid addiction epidemic to an end unless we prevent more Americans from becoming opioid addicted. And we know that the vast majority of people who've become opioid addicted over the past 20 years, their addiction began taking prescription opioids. Since 2012, prescribing has started to come down a bit, but we are still massively over-prescribing. Canada is number 2 in the world, and Canada also has a serious opioid problem, but we're almost double Canada. So we have a very long way to go. Setting a target makes sense, but what we haven't heard from the administration is how they intend to achieve that target.
It seems, Sam Quinones, that if you talk about reducing the number of prescriptions, just this ocean of pills that are out there, right, it's also very difficult in the absence of good treatment, in the absence of alternatives to painkillers. We're kind of stuck if we just start pulling people off the meds.
One of the things I think they really need to focus on, and I didn't hear it today, but I think it's an important thing to do, is begin to focus on what insurance companies reimburse for. Because if you just simply drop the number of pills, you'll have lots of people out there who will transition to the black market. They need other pain treatments that don't involve narcotics, acupuncture, but the diet, variety of things like this, various therapies that insurance companies were reimbursing for before, and they stopped years ago when they figured that, well, the pills are cheap, they're easy, they're non-addictive, so we're just going to go that route. That's another thing that I would have liked to have heard, is we're going to focus on insurance companies and what they reimburse for and what they are not reimbursing for today.
Andrew Kolodny, there's also this $6 billion that has been appropriated, but we don't really know the details of where that money is going to go, how it might be spent. If you were advising the president and he said to you, okay, I've got $6 billion, what do I do with it? What would you tell him?
Well, it's what we're hearing as a figure, $6 billion over 2 years. I don't think it's an adequate amount, and we also need a multi-year commitment. The Obama administration, President Obama on his way out the door, signed a law that has made $500 million available for the past 2 years. But even that money, because it's not a long-term commitment, the states have had trouble using that money, because if you're going to hire staff to build out a treatment program, it's difficult to just hire them for 1 or 2 years. We need a commitment for, I believe, 10 years of funding, and I would say about a $60 billion commitment over the next 10 years, or $6 billion a year for 10 years, so that we can create a system where someone who's opioid addicted can walk into a center and receive outpatient treatment for their opioid addiction, regardless of their ability to pay for it. That treatment has to be easier to access than a bag of dope if we want to see overdose deaths coming down.
All right, Andrew Kolodny, Sam Quinones, thank you both very much.
Thank you.
Thank you.